The number of drug overdose deaths is trending in the wrong direction in San Francisco. Today, city officials from the health department announced 84 people died from an overdose in August. KTVU's Jana Katsuyama spoke with a counselor on the front lines of this drug crisis. So, Jana, how does San Francisco plan on addressing this issue?
Well, Julie, the city says that they are launching a new web dashboard and extending hours for treatment for those who seek it. They say it takes everyone to try and help stop the stigma around addiction and treatment.
In San Francisco, the health workers and counselors on the front lines of the opioid epidemic feel the human toll of overdoses, professionally and personally.
We are getting deaths. I just had a personal patient just die this last week, and it's difficult.
Gilbert Sains is counseling supervisor at Bay Area Addiction Research and Treatment Center, or BART. He understands firsthand what San Francisco statistics are showing.
I am sad to report that 84 people died of an accidental overdose in August.
On Monday, the Department of Public Health announced the number of fatal opioid overdoses tied a record level. In response, the city announced the rollout of a new dashboard on the SF.gov website. It will show data on monthly overdoses as well as other numbers of people receiving treatment. The city also says they are partnering with organizations to extend hours to nights and weekends for medical treatment centers where people can walk in and get help, often on the same day, with drugs such as methadone and wraparound services with homeless advocates and counselors.
Addiction is something they have. It's not something they are. And it's difficult when they just don't show up.
Sain says his clinic's extended hours have seen a large number of new clients seeking help, but he feels they're fighting against what feels like a flood of fentanyl.
We had a gentleman, very young man, very talented man, trying to, get his postgraduate education. And he had OD'd 8 times in 2 weeks. And then we never seen him again.
Sain says what is helping are more patrols by San Francisco police to keep drug dealers away from the treatment centers.
There was a time outside my office window, there would be 20, 30 fentanyl dealers right outside our door.
Sain says now that has improved about 90%, and it's so critical to get people in the door where they don't feel tempted or triggered by drug dealing right outside. That BART clinic hopes to eventually get enough funding and staff to have a 24-hour round-the-clock open door, but that will take money, and right now they're just trying to extend the hours as much as they can. Julie.
Jana Katsuyama reporting live for us tonight. Jana, thank you.